Happy Wednesday. Welcome to Morning Coffee. We are so happy to see your faces this morning, to see you making your way to your computers. Good morning, Shalisha. Good morning, Lucretia. Good morning, Bethany. Good morning, Daphne, Therese, Corinda. Good morning, Patricia. We are very, very excited to be with you after a couple of weeks off. Again, my name is Lisa Payton Care, CEO and founder of the Foundation for Black Women's Wellness. And today we have a very special morning coffee conversation in honor of Breast Cancer Awareness Month. We are looking so forward to this very intimate conversation that we will have today with very special guest, Ms. Delilah Bell and our very own Erin Winston, who is a member of the foundation staff, a program manager, and a breast cancer educator. And I would say she's a breast cancer expert. She wouldn't say that, but I'm saying it for her.
I would.
And we're very, very excited to have this conversation, given what we know about the incredible risk that breast cancer poses to Black women. But first, to acknowledge our Foundation for Black Women's Wellness team, who are also here with us, Janine Stevens and April Kigea in the background. And I love seeing our board members join our call. Corinda and Adrienne, is wonderful to have board members on our call as well. Our Chief Programs Officer and co-host Aaliyah Stevenson is not with us today, but we're nodding her this morning as we start this morning coffee call, which, as you all know, is our wellness hour to come together and learn, refresh ourselves, connect, and to talk about ways that we can elevate our health as well, Black women. So with that, I don't know if we have a special business to feature today, but I know that we really want to focus this conversation on breast cancer. But if you guys notice these incredible earrings that I am
Cute.
wearing today, aren't they pretty?
Yes.
My goodness, they are gorgeous. They came in the mail from a business called Flida Earrings, flida.bigcartel.com. I'm going to drop this in the chat. Here's the business card. I'm so elated that they thought to send these to us as gifts. They're beautiful, and we will promote this today because I've been asked about these earrings when I've been out. So with that, I'll also say, Erin, do you have something you'd like to share with us about a breast cancer pledge?
Yeah, so I will be going ahead and dropping a mammography pledge into the chat here as we're talking real quick. So for 2021, the Foundation for Black Women's Wellness is happy and super proud to announce that the Witness Project of Madison has a permanent home in the foundation. The Witness Project of Madison is a breast and cervical cancer education program specifically for African American women. It's been here in the Madison community for over 26 years, thanks to Dr. Michelle DeBose, and has been traveling with me for the last decade. And so we will be launching new programming in 2021. You can sign up for a mammography pledge in 2021, and I'll be dropping mad prizes in 2021 if you sign up to have a conversation with one of our team members about your current status for screening and have a conversation with your doctor and then schedule your mammogram. So you guys click that link, sign up for the pledge for 2021.
Yes, that is amazing.
Yes.
All of that. The Witness Project was really a forerunner project in the greater Madison area, initiated by a Black woman, Dr. Michelle DeBose, with Erin all along the way as a research assistant and coordinator for that program. It was out there when there was nothing for us to connect to around our unique needs and support needs as breast cancer survivors, and also, of course, for prevention. And we're very happy for that legacy project to now be embedded in the work of the Foundation for Black Women's Wellness to expand our education and support and prevention efforts. And we thank you, Erin, for that. I'd also like to acknowledge Joshua Wright, who joined the call from the UW Carbone Cancer Center, who have been incredible partners in our efforts over the years. Erin was also a former member of that team, and together for several years, we worked with the Carbone Cancer Center at the UW-Madison School of Medicine and Public Health to increase access to screening, opportunities for Black women, affordable, no cost, low cost, and for education to prevent the spread of breast cancer in our community. So Joshua, I say hello to you and the Carbone Cancer Center. We're typically streaming live on Facebook for our morning coffees, but we have been having trouble with Facebook. It's not responding. So I know our team is in the background working to attempt to connect. Let us know if we're going live on YouTube, Erin, and we can pass that information along to viewers who are beyond our Zoom call this morning. So getting to the meat of it. We are very happy today to have, as I said, special guest Delilah Bell, who is a breast cancer survivor. And we really want to tell the stories. A big part of our work is telling the stories of Black women who have overcome. Oftentimes when we focus on breast cancer, it's about the number of deaths and all of that, but women survive breast cancer and it is a fight. And we want to talk about the life-bearing stories of women who have fought, who are winning this battle, and who are going on to live and to share their stories so that we can collectively surround them and celebrate their life, but also have the information that we need in the event that we face this challenge in our own lives. So a little bit about Delilah. Delilah is a natural caregiver, is a retired nursing assistant who worked with patients with Alzheimer's and dementia and regularly volunteers when she can. She is a mom of 4 with 11 grandchildren who she has the joy of being with and caring for. That is an incredible blessing, Delilah.
Yes.
Yes, it is. She is a member of Mount Zion Baptist Church here in Madison and an avid reader and a 21-year breast cancer survivor. Let's snap it up for 21 years of survivorship. Delilah's family has a history of cancer, and her diagnosis, along with the diagnosis of her mother and her sister, led her to share her story and to get genetically tested for the BRCA gene, which she will share with us as we talk today. 62 years old, diagnosed
52.
at 52. She said,
Yeah.
shave off those extra 2 years, people, shave off. 52 years old, diagnosed at 30 years old, which is very interesting dynamic as we know that Black women are more likely to be diagnosed at a younger age with very aggressive forms of breast cancer. At 30, when Delilah was diagnosed, she was the mom of 4 children. 3rd generation of cancer, grandmother ovarian cancer, mom BRCA, aunt and sister also had the BRCA gene. Niece is 33 with the BRCA gene, another niece that has tested positive for the BRCA gene. So this is a very serious issue in your family, Delilah, a very timely conversation that's bringing up many, many layers of the work that has to be done to prevent on a personal level and the awareness and the information we need to pursue the appropriate treatment to preempt the onset of breast cancer. I also want to do due diligence to Erin. We love her and we work with her every day, but I want to tell you just a little bit about her. Erin Bailey Winston has served as a program manager for the foundation since February of this year, and previously she was a partner to the foundation extensively on our community education and outreach work. She is a current student in the Society and Community Research Program. Some of this may have gotten cut off in your bio that I printed out. She is a 2009 SOHE School of Human Ecology graduate at the UW-Madison with a BS in Human Development and Family Studies, and has worked for almost 2 decades for the Witness Project of Madison in several capacities, which we explained earlier, which is a cancer prevention and education initiative specifically targeting African-American women. Tell us a little bit more, Erin, because your bio is cut off. All I know is that you are an expert in the field of breast cancer. She has led trainings across our county and our state, has developed trainings for practitioners and for patients around breast cancer education. I've had the opportunity to go through Erin's training and to see what she's developed in the battery of learning around the breast cancer arena in our state and at the university. And it's been quite impactful. She is changing lives every day, and we thank her for that. Anything to add? Did I miss anything crucial, Erin?
No, I sound fancy sometimes though. It's a little alarming some days. So
It's very special, and the world needs to know. So with that
Yeah.
being said, again, we want to welcome everyone who is listening here today. We want you to drop a message in our chat and tell us on a scale of 1 to 10 how you're feeling, today. And we're sending out big, strong, powerful vibes to all of you as we listen in. So, Delilah,
Yes.
tell us a little bit more just about you, before we delve into your breast cancer journey.
First of all, I would like to thank you all for having me this morning. Um, First of all, well, second of all, I would like to acknowledge my Lord and Savior,
Mhm.
Jesus Christ. And if it wasn't for him, plain and simple, I wouldn't be here today. Um, I love people. I love spreading the message, not just about God, but spreading the message to let women know um, that they can also survive, and to encourage, yeah, and just to be there to support in any capacity that I can.
Absolutely. I know you, Delilah, through community connections and relationships, and have always admired you from afar. I have watched your strong family roots and how tight knit your family is. You've talked on social media about your breast cancer journey. And it's been beautiful to see your son be such a champion in your support system. We can see the deep love and honor that is embedded in that relationship, and how highly you speak of all of the women in your family. And we know that support, right, and our faith are such critical parts to our wellness and helping us overcome and fight, conditions, life-threatening conditions. When you have
Yeah,
that support, it makes an incredible difference. So,
yes, it does.
yes, it does. Yes, it does. Tell us about your breast health journey. When did this begin? At 30, when you got
Wow.
the news?
Yes, at 30. Seems like a lifetime ago, but not really. Um, Amazingly, and a lot of people that I speak with, they're not want to say in doubt, but it was just incredible how I found the tumor myself. I had bathed that night. I didn't feel anything. Woke up that morning to freshen up to get ready for work. And there it was, large as ever. I'm like, oh my God, where did this come from? Snap out of it, girl. You're dreaming. But it wasn't a dream, it was my reality. And I proceeded, I went on to work, couldn't function. So my supervisor told me to call my doctor. I went into the clinic and I just knew by the look on his face. He had been my family doctor for 20 something years. And I just knew. And the next day I was at the cancer clinic, for my first mammogram, actually. Although my mom was a survivor, but they continued to tell me that I was too young, although we had a significant history. They said that I was too young, my breast was too dense, and so on and so forth. And there you have it. I had breast cancer.
So this was 30 years old. Um,
Yes.
30 years old. Had anyone in your family been diagnosed with breast cancer before you?
My mother and a couple of cousins.
And the doctor told you that you were too young, your breasts were too dense, and it didn't appear initially to be an issue until they looked
Right.
deeply.
Right. Although they knew my family history.
Wow, that's such a crucial piece to take in, because it's such a fundamental part of our work, of the extra work Black women have to do to be believed. by our physicians and in healthcare settings when we go and say, I know something is wrong, and they tell us,
Right.
no, it's not.
Right.
We know in the data, in the research, that one of the biggest challenges to us not beating cancer is late detection. And some of that late detection may be because we didn't go as soon as we felt something, but in many cases, it's because it wasn't probed even when we brought it to our doctor's attention. So it was missed. So I'm
Right.
so glad that you persisted. How did you know something was wrong? When you were doing the self exam, how did you know that it was abnormal, unusual?
I felt the lump. I knew that that wasn't normal. And then something told me to get a piece of tissue, and I had never heard this before. Get a piece of tissue and squeeze my nipple. And sure enough, it was green, you know. And I said, what in the world is this? And I called my mother on my way to work, and she advised me, girl, go to the doctor. Why are you going to work? I'm like, Mom, I just can't. I don't want to deal with this right now. But I'm glad I finally went the next day. Well, that day.
And so I'm going to ask you a question. I'm going to ask you in a minute what happened next. But first, I want to pose a question to all the guests. Are you making it a regular practice to examine your breasts at home? Are you doing this? Have you done that this year?
Right.
Have you done a self breast examination? Particularly if you're under 40. And what I'm hearing and understanding, and Erin can clarify this, if you're 40 and up, you should be scheduling your first mammogram already as a Black woman.
Yeah, so I'll clarify that real quick. So this is really tricky, and I'm going to talk only for Black women, but I'm going to give you a quick history about kind of national guidelines and then what we think about when we think about cancer guidelines. So there's a national federal body called the USPSTF. You never have to remember this, but they are essentially a body of clinicians and PhD researchers who do all of this cool research about what we should be doing for our bodies. The problem is too often Black folks, Black women especially, are not involved in research. So they're making recommendations on guidelines where we're not included really well in what the research is saying we should be doing. So ACS, or American Cancer Society, says age 45. USPSTF says 50. But for Black women, we are more often diagnosed earlier and with more aggressive forms of cancer than our white counterparts. So if you have a conversation with your doctor, you want to talk about your personal risk factors. And we are very clear about this. It's a risk assessment for yourself. For example, for me, my mom was diagnosed with breast cancer at 42 years of age. I'm 39 right now. So I have been actually getting mammograms since I was 26. I'm biracial, so that actually increases the likelihood that I have cancer a little bit earlier. And they don't study biracial folks yet very well. So I've been having mammograms since I was 26. I also have an MRI every year, and then I go and get clinical breast exams twice a year. So I'm seen in a high-risk clinic because my mother was diagnosed so early. So all of those things have my own personal risk factor profile, the same way that Delilah's personal risk factor is different than mine because she has also a family history and the BRCA gene. So her risk factors are higher than mine. I don't know if I have BRCA or another gene. I'm getting tested this year. But we encourage women to go talk to their doctor, talk about your own personal history if you know it, and then talk about your family history because that can change the guidelines for your screening. Case in point, a little bit outside of breast cancer, I had colorectal cancer screening 3 years ago. So my risk profile is different than the average person. That thing is normally you happen at 50. I had mine done at 36. So we talk about being active and having conversations with your doctor about when is appropriate for you.
Oh, so much information. So when we ask the question, are you doing your regular self breast exams? And how often should we be doing these, Erin, at home, like Delilah did all those years ago? How often?
Yeah, so we talk about breast awareness. So girls should actually start examining their breasts when they have their first menstrual cycle. So if you're 11, 12, some Black girls tend to have ours early, 10, 9, whatever that age is. Black girls should actually start examining their breasts as soon as they have their first menstrual cycle. And what we're doing is we're just checking for how our breasts feel. Is the tissue dense? Can we feel things? Are there changes in our nipple or the shape or the volume of our breast tissue? And those things change over our lifetime. So as we grow breasts, we all are born with nipples and like this breast tissue. But as our breast tissue changes over our lifetime, the shape, the feel, the size of our breasts also change. And so I'm like always the person, Delilah knows, she's been in a room with me when I've been like, so here's my breast. And then let's talk about what's going here.
Right.
I want to know what my breasts feel like. My breasts feel different today after having a baby and breastfeeding for 2 years than they did before I got pregnant. So I need to know. So we say every month you should be checking your breasts, and this shouldn't be happening during your menstrual cycle. It should be at least a week after your menstrual cycle that you're examining your breast tissue, and you're looking for any physical changes in your breast. You're looking for any weird nipple discharge, or if you can feel any lumps. And the more that you're familiar with your body, the easier it is to feel changes.
Wow. So April, tell us what we're hearing in the chat. We're seeing a lot of great questions. We're seeing a lot of great responses from women.
Yeah, so just a great topic. A lot of women do self-breast exams monthly. People talking about, early diagnosis within the Black community and just how we need to be aware and definitely stay on track with these monthly exams.
Yes, and I'm happy to see that some women said, yes, I've done mine. Yes, I had my mammogram at 40. Yes, I had mine this year. And do you guys hear me, see me? Am I frozen? I froze for a minute. Can you see me, hear me?
Yes.
Okay, that was very interesting. So Delilah, and we'll come back to
Yes.
some of the questions. Folks want to know what does having dense breasts mean? I was told that a few years ago, and I'll share a story with you in a minute. Folks want to better understand the BRCA gene, but Delilah, so what happened after that doctor's appointment where it was confirmed you have breast cancer? What next?
Um, wow. What next? Okay, first of all, I want to say everything happened seems like in one day. I had the mammogram. A few hours later, they told me to go to lunch and just relax and come back in a few hours. I had the fine needle aspiration. Um, and some more exams. And once they came, I mean, it was like a team of doctors came in. And my mom was unable to go with me for whatever reason, but my best friend was there. And I thank God that she was, because I almost hit the floor. So when I seen all of the white coats come in, I knew something definitely was wrong. And they were like, Delilah, have a seat. And I said, I refused because I said from hearing people when they say have a seat, it's bad news. So I say, well, whatever it is, just give it to me while I'm standing. And they says, well, at 30 years old, I'm sorry to inform you that you have breast cancer. And that's when my life changed. Yeah.
What went through your head when you heard the words, you have breast cancer? What was the thought process?
I immediately thought about my children, about my babies, like, God, I don't want to die. I've never been married, still haven't, but I haven't traveled. I want to do this. I want to do A, B, and C. I'm not ready, but from what I believe, I didn't go through that for me. I went through that for all of the other women that I have met so far and all of the women that I will meet, to encourage and to support and, all of those good things.
That's so powerful. And I rest in a minute in thinking about, at the end of your journey now in so many years being cancer free, but remembering that moment when you heard the words. About 4 years ago, I went for my first mammogram, and I do not have a family history of breast cancer or cancer. But because of my age and because I'm surrounded by people like Erin, I knew that I needed to go at 44 to have that first mammogram. And I expected it to be completely routine and to just say, okay, clean bill of health. But instead they say, you know, we see some concerning masses on your left breast.
Mm.
And I said, oh my gosh. So this, you know, you go do the mammogram, they call you back in. So they called
Right.
me back in to say this. And I had to go through 2 more separate appointments, battery of a second, you know, mammogram, some other screenings. And the white coats walked in on the third one and they said, you know what, there's one more test we need to do because you've got dense breasts. And we can't see it as clearly, but there's something not quite right. And so then they did a biopsy and they came back, and Corinda said, this happened to me as well. The terror that sprung up in my heart when they said, you know, we've done 3 tests and we still see something concerning and we need to biopsy it. My life flashed before my eyes as well. My 5 children, all the things that I want to do, and what that would mean if they came back with a positive diagnosis, and all the questions that I had. It educated me a great deal. Also, that family history is not an indicator that you're free
Right.
and clear of breast cancer risk.
Right.
If you do have family history, it's an added risk, but you can have no family history whatsoever, and get breast cancer.
Right.
Um, and when I walked down the hallway for that second and third test, I had to go to the UW hospital to the Carbone Cancer Center. When I passed that sign on the wall that said Carbone Cancer Center, it got
Surreal.
real. It
Yeah.
got so real. So I want to say to everyone on this call who has not gone to get your mammogram, who has not done your monthly breast exam, do it today. Do
Yes.
it today because prevention is key. I don't want anyone to feel that terror. Um, and I want you to have the best information at your disposal so that if you do hear something about something concerning, you can remain calm, you can remember our stories, and you can know to go through the process of testing. If you don't know what a mammogram is, if you don't know how to do a breast self-exam, Erin will pop tools in the chat. Call her, she can tell you what to do from point A to
Mhm.
point B. So you made it through the news, you made it through those thought processes, and then treatment began, I presume.
Treatment. Yes. Treatment began, and that was awful. It was cancer is hell, plain and simple. It is. And the surgery, I'm like, no, I don't want to lose my breasts, but they're breasts. You can always get new ones. you know. It's about saving your life. My hair, I didn't want to lose my hair. And that hair story was something else. That was something else. And I still don't like hair. Amazingly, I don't like hair. I like my hair shorter the better, which is ironic. But I made it through. I had a huge support system. Um, Losing my breast and to see the scar, the humongous scar, the scars from removal of the lymph nodes. Wow. I didn't think that mentally, I didn't think that I would come back from there. And I'm like, look, you have strong faith. You have to pick yourself up by the bootstraps. You're going to beat this. You're going to beat this. And you have to have a very positive attitude.
This is just bringing up so many thoughts in the thought of how many additional calls we'll need to have. I know a young woman whose mother died of triple negative breast cancer, and she and her sister discovered that they have the BRCA gene as well. And she decided preemptively to have a double mastectomy once she learned that she had the gene. And she has talked about her story of that sense of loss at the thought of losing our breasts as women. And we know for some women, they've told us that they haven't pursued proper treatment because they don't want to lose their breasts.
Right.
That's a big part of this conversation of really doing the work to consider what matters at the end of the day is life and
Right.
living, but how can we
It's more
educate,
important.
you know, life and living. We're not defined by our breasts, but we have to acknowledge as women that they're a part of who we are and our personhood from the moment we were born. So it's not wrong to have those thoughts and that attachment, but how do we reconcile that with saving our lives, right?
Exactly. Right.
So what did treatment look like, Delilah, before the decision was made to have the double mastectomy, right?
Yes. Treatment, I had 8 cycles of andriamycin and cytoxin. And um, I, my memory is challenged, but some things you just never forget. Yeah. And let me just say one thing about my surgeon. His bedside manner was awful.
Mm.
He says, well, we're going to have to remove your breast. And that was it. And I'm like asking all of these questions, and he's just looking at me, pulled his glasses down, and basically, well, it is what it is. It's like it's no discussion. And I opted to have a second opinion, um, and it was breast cancer. I hope I answered your question correctly. I'm kind of nervous,
You're
guys.
answering a lot of questions, even ones I intend to ask. We can't talk enough. You said that bedside manner. Oh my goodness, whether we're talking about breast cancer, whether we're talking about maternal care, child, whether we're talking about how we're treated in pregnancy, whether we're talking about other conditions, the frequency that we hear this story about um, insensitive providers. And
Mhm.
God bless the great providers. God bless the
Right.
great providers, they exist. But
Mhm.
this issue that you've raised now twice in this meeting, which we've heard continuously throughout our work with the foundation of physicians who don't listen or who treat us in ways that make us feel less than human, less than ourselves.
Right.
Yes, they're delivering. So
Irrelevant.
giving you
Right.
valuable information that, this is serious and this is the course we have to take. But the way it's delivered with humanity and with respect, um, is often not there, and we don't deserve to experience that,
Exactly.
especially when facing a life or death decision
Right.
about our health. So, Erin, what are some of the supportive programs? As I think about what Delilah is telling me, and women call us, to say, I've got this diagnosis and I'm worried and I don't know what to do. And I've been to this healthcare provider and they're insensitive, and who else is out there that I can contact to walk with me as I'm making decisions about this diagnosis that I've gotten.
Yeah, so first and foremost, reminder, the Witness Project is here. We're here. It's me, and we're going to be growing into 2021. If you have questions, call me, reach out via email. We'll drop all that information in the chat for you guys. But first and foremost, we have the Wisconsin Well Woman program here in Wisconsin. Actually, every single state, so all 50 states have this National Breast and Cervical Cancer Education Program. Wisconsin Well Woman program is the program here in Wisconsin. The Well Woman program provides uninsured and underinsured women with breast and cervical screening, and also provides some treatment things. They have coordinators who are regional, and so they also have some navigators who are embedded in these regional things. We actually have an office here in Madison. Carrie Sievert is the Well Woman coordinator here. So if you're here locally in Dane County, you can reach out to her office, and they can actually help you like get information about breast cancer screening options, what happens after screening if you do have a positive result from mammography screening and or biopsy. And then additionally, we do have a National Cancer Institute cancer center here. The Carbone Cancer Center is the only NCI designated cancer center in the state. It's a comprehensive cancer center. They have education, they have outreach, they have navigators in the breast center, which is where I'm seen in clinic. And that breast center, which is what Lisa was talking about, is right across from the cancer center. So it's all on the same floor. So that's nice. And what I would like to say is the breast center's director, Dr. Lee Wilkie, she's actually super duper amazing. She's a surgeon, and having a woman in a place that she can understand where you're coming from has been very beneficial in how the center is run and how they have upped the ante essentially in making sure that women are treated kindly and with respect, and understanding when they come in. So that may have changed a lot since Delilah had her surgery. And I want to be really mindful of saying, you guys are employing doctors. Your insurance is employing doctors, or however is getting paid. So if something's wrong, fire that person. It's pretty simple. I think a lot of times we're not empowered to say we can get a second opinion or we can get care from someone else. And that is okay to say to someone, because you are employing them, you are paying them for their time. So besides those places, Wisconsin Well Woman Program, there's a lot of different places in Wisconsin. We have several different funds that actually help fund mammography screening, cancer care. But the primary thing is reach out. A lot of the times when you have a diagnosis, you're in a fog of like, I don't know what's going on. But if you can, reach out. Usually if you can reach out to a friend or family member, they can usually connect you to other things. If you're actually in the cancer center with a diagnosis, they do have navigators that can connect you to various places, as well as psychologists who are primarily work with cancer patients. So the Cancer Center has a really robust psychological program with therapists in there that help you. They're specifically trained for cancer stuff. But we're here to help. If you ever have issues or you're scared to get a mammogram, I can Zoom in with you to go. I've had plenty of them. I have other survivors who are willing to help you, talk to you, sit with you, explain what's going through, and just kind of listen. Sometimes you just need somebody to sit and listen. So we're here for all that.
Yes. So what Erin basically said is, when in doubt on any of these resources and forms of support, call the Foundation for Black Women's Wellness and we will help guide you. We do that daily. We've been very blessed and fortunate with a network to have great relationships with the Carbone Cancer Center, to have, and again, Joshua Wright is on the phone call today. They've been great partners and supporters of the work of the foundation. We have the Wisconsin Well Woman Program on speed dial because we refer tons of women to that program for information on low cost and no cost breast cancer, cervical cancer screenings, and to learn how they can access appropriate, affordable care. And that program serves women across our state with an emphasis, Erin, correct, on women 45 and above. Is that correct for Wisconsin Well Woman Program?
40 and above. So
40
because
and
it's a
above.
national, it's a national program with federal guidelines. So 40 and above.
Yes, so I'm very excited, April, to see that we have survivors. So Andrea Harris says, that's how I found the breast cancer in my breast. Thank God for self-breast exams. I'm a 10-year breast cancer survivor. That's awesome. Andrea, we are celebrating your life today. Someone says, Tamra, yes, I had that terror when we talked about the terror of going into the center when they performed a biopsy on me in 2011 at 30 years old. So I am hoping that the women on this call who are 20 to 30, 20 to 35, 20 to 40, I hope you are hearing that you have to start thinking about breast health now. This is not something to wait until you're in your 40s or 50s or 60s. You have to be proactive now and focusing on your breast health, because we're hearing women who did go at 30 and we're finding things. Delilah, 30. Someone said that happened to me too. Someone has downloaded the mammography pledge. Mama Mona says, I had to have an ultrasound last year after my mammogram. It's frightening to get called back in for more tests. Praise God, mine were all negative. Praise God, mine were too after those 3 different exams. A team of doctors, when they brought in the team of doctors to probe, 4 or 5, Lord have mercy. Thank you, God.
Exposed.
Oh my God. goodness, all of the psychological piece of that exposure, right? What you
Right.
go through. Mm. Someone asked, do you have to be over a certain age, even if you have kids? Letitia, let us know what you mean by that. If you can ask the question again, do you have to be over a certain age if you have kids?
Yep, I actually caught that question earlier. So Letitia was asking about mammography screening. So the answer is this is often driven by insurance, which sucks. Hello, United States. But it's often driven by insurance when you can get your mammogram. However, if you find something concerning, you have a family history, if you've talked to your doctor can often make a recommendation that then supersedes or goes over the insurance, which allows you to go ahead and get in early. Again, you have to have factors or other risk factors for this to get early mammography screening, but being Black is actually a risk screening for getting an early mammogram. And I wanted to follow back with what Lisa said earlier too. Most new cancer diagnoses are actually from people who have no family history. So it's vitally important that you don't think because someone else has a genetic disposition that they're going to get it. Cancer genes are funny. All genetics are funny. There's like a little dial. We don't know how much is going to get turned on or if it's going to be off or what's going to happen in the middle. So most cancer diagnoses are actually from people with no family history. So you want to be really mindful of going through, again, from menstrual cycle, that first menstrual cycle, you should be examining your breasts every month, figuring out what your body is, and really understanding like what your body is telling you. If you're not feeling well, you have lumps underneath your armpits, like in your breast tissue, you have weird discharge, go and get checked and continue to advocate for yourself. So you can get mammography screening early. Yeah.
Do not wait.
Right.
If your body is telling you something's off, we're not talking about heart disease today, but I'm going to talk about my mother. My mother died at 64 from congestive heart failure, and you all know that this is the reason that all of this work began. She, like many, because of distrust, because of lack of trust or uncomfortable, we've had the uncomfortable, unpleasant experiences with physicians, right? When we get a great physician, very fortunate, but distrust keeps us from the doctor sometimes, or with a combination of being very busy, with being hyper overextended. We're raising children, we're working, we're involved in the community, right? All of us, especially these Black women in Madison who are super overachievers, we're out here doing the most. However, when our body says, you know what, something's off, something's not right, we may wait for weeks. We might have a migraine for weeks. We may have pain in our side for 2 months. We may have an ache or something for 6 months. We're like, oh yeah, I'm gonna go get that checked. That has to stop.
Yes.
That has to stop because early detection in all cases is life-saving. I
Yes.
have a dear friend who was recently diagnosed with stage 4 colon cancer. And the one thing that I recall her saying to me is, I was feeling strange 2 years ago. I was feeling off, but I'm always off. I'm always running. I'm raising my kids. I got this demanding job. I was just off, but I just never thought. And by the time she went stage 4, now, of course, she's beating it. She's fighting it. She's got excellent care, but she's not out of the woods yet, but she's fighting it and it's working. But she asked, what if I had gone 2 years ago? So please don't leave this call without hearing me say clearly, if something's off and it's been off for a minute, schedule that appointment today.
Can I mention two things, please, before I forget?
Absolutely.
My cancer, when it was finally detected, it was stage 3. And the last thing is when my niece was diagnosed last week due to COVID-19, she had to go in alone. So my sister and her other daughters had to wait downstairs. I just can't imagine having to hear that news by yourself.
Oh my goodness. So raise your hand if you're going to commit today with whatever your next step in your medical self-care that you're going to make the call today, right? you're gonna make the call. If you can't make it today, you're gonna make it by Friday. Right, we're not giving you past Friday to make that call. Yes,
Yeah.
Courtney, I'm looking right at you, Courtney, as you raise your hand. I'm looking at you, Therese. I saw you raise your hand. I saw Frances raise her hand. I saw Miss Daphne. Everybody's hands were raised. Shalisha. I'm loving the resources that we're sharing. I'm loving Joshua gave the information about the Witness Project. Erin has dropped in the mammography pledge again. We are seeing names of physicians, Carrie Sievert, Dane County Well Woman Program, reach out. I also saw someone who says, Veronica Scott Fulton, hello to this team. Please note I am an advocate for Black women utilizing SSM Health services. So connect to Veronica if your healthcare provider is SSM Health. Welcome, Veronica. We would love to connect with you after this. Let's ask a few questions that were asked earlier. So when we hear this term, we have dense breasts. What does that mean, Erin? And then next, and yes, thank you, Courtney, for telling us that Planned Parenthood also does breast cancer screenings. People don't realize that
I
Planned
never
Parenthood
knew that.
offers a massive number of screenings and services. Did you know that, Delilah?
No. First
So
time hearing it.
women who don't have health insurance, you can go to Planned Parenthood to get breast cancer screening. I think they may do cervical cancer screening, and it's crucial for us as Black women because we are disproportionately impacted by those cancers. And I will tell you that cancer is the #1 cause of death for Black women in Dane County. Heart disease is second, and it's usually the other way around. So we have considerable cause to be very hyper vigilant about cancer prevention in our very own community. So what is dense breasts, Erin? I have them and don't quite get it.
Yeah, no, I know. You're like, what is density? Without getting super technical, does everyone remember the Princess and the Pea story from when you were little? So the princess was really uncomfortable on this mattress. They kept stacking the mattress up really high, and then they could feel the pea still. So dense breast tissue is essentially more than a couple of mattresses. So if we wanted to think about like building up layers of paper and like putting a rock underneath or some fabric, essentially you have more mattresses, right? To get to the P at the very bottom. So if we were thinking about just laying on one mattress, like the average, we'll just throw it like an average woman would have 1 or 2 mattresses that she's laying on. But a woman with breast tissue or with dense breast tissue would have like 20 mattresses to get to the little stone underneath. So I hope that makes sense for people. It's just saying that your tissue connectivity is just more in there. So you have to really understand like how breast tissue is and how it works together and like the muscle and all the tissue together. It just means that it's harder to feel things underneath. Black women tend to have more dense breasts, and density doesn't have anything to do with size. So I am, I think, a 34 double G now after I had my baby. No, I'm free about my business, people. So
It's
you don't have to drop your cup size in the chat. But it's
our bra sizes in the
Say,
chat.
don't judge
I don't
me.
care, drop them in, okay? But I'm saying I have really big breasts, but I don't have dense breasts. So the size of your breasts don't matter. Some women can have really small breasts, like very small A cup size, and still have dense breast tissue. So let's be very clear. The size of our breast does not determine the density of our breasts. Our breast density is really determined about, again, all of those genetic components that we have. The likelihood of me having my child having dense breast is pretty low. My mother-in-law is actually on here, so I could ask her. Like, hey mom, tell me about your breast tissue. So these are things that we think about when we think about breast density. It's really about how many layers it takes to get to feel something and how we have to manipulate the breast when we're doing mammography screening or clinical breast exams to see or feel things in the breast tissue.
Awesome. That was instructive. And Mama Mona is Erin's mother-in-law. And I love what she said. These are conversations we need to be having in our house. We need to be having these frank conversations. Someone asked earlier, how do I break this conversation down to my 12-year-old? You just start breaking it down. You know, as she said, as Erin said, after that first menstrual cycle onsets, our girls' bodies, you know, they're transforming into women, and we've got women's issues to address. So we begin to break this information down in small pieces, digestible pieces, seek out expert advice. The internet is alive and well with credible sources of information
Right.
about breast cancer education and prevention. So seek it out, but start those conversations early about our bodies. One of those things we've talked about a lot in this work is that often in our culture, we have had, for whatever reasons, we've not talked intimately about our bodies and our health to each other. And this is a new behavior. Talk to your mother, your sister, your daughter, your niece, your auntie about breast health. Ask them, have you gone to get your mammogram, sis? Have you done your breast self-exam? Let's commit to doing ours this week. You tell me what you found, I tell you what I found, and pass these resources on, because that's how we get ahead of this and begin to prevent. Erin, Delilah told us that in her history, there's a genetic risk, the BRCA gene. What is this BRCA gene that every Black woman on this call needs to understand before this call ends today?
So we know that genetics are the building or the blueprint for what our body does and how it reacts to certain things, how we live, where we work, what we're exposed to, while we treat our body. Delilah has BRCA1 gene. There's two what we'll call breast cancer genetic genes, BRCA1 and BRCA2. Delilah has BRCA1, as well as I believe her niece and her sister, if I remember correctly. And when you look at Delilah's genetic history, she had a maternal grandmother with ovarian cancer, and then her mother had breast cancer. She has breast cancer, her sister does, and then she has nieces who have been diagnosed and then who also have genetic disposition to the disease. The ovarian cancer is the one that actually triggers usually people, because ovarian and breast cancer are actually really closely tied to BRCA1 and BRCA2 gene, which is why it's really important to know if you have it or not if you've been diagnosed, because you have to be more vigilant about your ovaries if you've been diagnosed with breast cancer. So BRCA1 and BRCA2 are usually telling women that you have a higher likelihood of developing breast cancer during your lifetime. Does that mean you're going to get breast cancer? No. It just means that it changes your risk profile and it changes how vigilant or how much screening you need to do. So I talked earlier about my mom being diagnosed at 42. My mom's white. My father was Black. My mom had a family history of cancer. And so that delineated it, whether or not I needed to have early screening. But my mom's really early diagnosis, I should have started screening at 32, but because we had other family history in there, they started my screening even earlier than that. So at 39, I've had mammograms every year since I was 26, which is wild, right? Some people I know on this call are several years older than me and haven't gone yet. Call me if you need a friend, I'll be there. So it just changes your screening profile. It means that I need to be more vigilant about making sure that I'm doing my monthly breast exams, making sure that I'm going in and getting my clinical breast exam done, making sure that I'm getting my mammography screening, making sure that I have like cystic ovaries on my right side, like making sure that I'm getting those checked out regularly because it could be not a cyst. So thinking through like what I have to be proactive about and my long-term kind of health needs. And so it just means being more vigilant about that. Now, BRCA1 and BRCA2 are not the only breast cancer genes. I unfortunately had a male cousin pass away last year who has something called liformanes. Liformanes is also a cancer gene. There's a set of genes that kind of predispose you to have cancer. So people's genetic profiles are a lot different. BRCA1 and BRCA2 just happens to be more prolific in breast cancers. So those are the two genes that we most often talk about. So that's kind of what BRCA1 and BRCA2 is. It just raises your risk profile. Doesn't mean you're going to get cancer. It just means that you have to be more proactive about your health.
So how do women learn? We hear a lot about going to get genetic testing to learn if you're at risk. How does one access genetic testing if they want to find out now so they know how vigilant they need to be with prevention?
Yep, it starts with a conversation with your doctor. You send a message. I advocate for using your MyChart or using your digital stuff because it also leaves a breadcrumb trail in case your provider's not listening to you, that you can point definitively to that you requested something. So use your electronic records if you can, people. Send a message, say, I'd like to talk about breast cancer risk and I'd like to talk about genetic testing. And what they'll do is they'll sit down. They actually have testing stuff where they can plug in your information and it spits out a risk assessment. And then based on that risk assessment, it may trigger a referral or not. For me, my risk assessment when they plugged it in, it like put out an assessment that was over 20% for a lifetime risk for breast cancer. So I had an automatic trigger referral at 26 into the high risk clinic. There are things in place that trigger referrals, but leave a breadcrumb trail in your electronic records so that it's definitively defined inside of those EMR records that you've requested this information be communicated to you and that you have the conversation.
So how many folks have checked their MyChart account? If you have MyChart, have you checked it lately? Do you use it to send messages to your physician to leave that trail of how much, what
Yeah.
you're requesting and what you're needing, and if there's a responsiveness? That is part of being an advocate for yourself. I love MyChart documents. I love MyChart. Great. I see that folks are loving it. I'm going to log into MyChart today because there is something that I need to follow up about. So Delilah, as a survivor, and again, just celebrating the fact that you are sitting in your home talking to us today at 52 years old as a 20-year breast cancer
21.
survivor. Hmm?
21.
21, don't let us take a year away. 21 years as a breast cancer survivor. How are you best taking care of yourself now, mentally and physically, given that you've learned how precious life is, right? You've gone to the mountaintop and you've come close, right?
Hmm.
How has it changed your life, and how do you live now as a survivor?
Quite honestly, losing my mom last year, that that that's the worst, well, the second worst thing ever that has happened to me. But moving forward, I could hear my mom. She used to always tell me, live, Lila, live, just live, And my world, quite honestly, revolves around my children and my grandchildren. But recently, I have decided that I'm going to put Delilah first, whatever that looks like.
Yes.
My oldest son, Big Mike, always tell me, Mom, you've raised your kids. Do what makes you feel good, what makes you happy, and there are several things that makes me happy. And I'm going to get back to doing that. I'm going to get back to being in charge of my life, tell my story, so yeah.
Have you changed any health habits, or how you engage in your health care management? What has it altered in that sense?
Honey, quite honestly, no, I have not changed my health habits. I still eat anything and everything. But I'm going to change that as well because this COVID thing is getting to me in the house, all the time, eating everything. Yeah, I'm going to start focusing on my health more so now than ever.
I so love your blatant honesty and saying, you know what, I'm struggling in that way, but I'm going to start, because you can start at any time. It's
Yeah,
never too late to begin. And we push that message because we know there are preventative behaviors that we can undertake immediately in terms of being vigilant about what we consume. There are healthier options in food choices. There's the
yeah,
elimination of smoking and intake of less alcohol. There's not eating processed foods, and to the extent you can afford it, to buy food from healthy sources that are organic and farm raised or locally sourced, and all those things that we can
right.
do, right? So those habits help. We also know that cancer and other diseases, are often caused by environmental factors that are outside of our control. But, being mindful of clean water, clean air, being vigilant about knowing how our community is managing toxins and waste and protecting ourselves, and becoming advocates for how our community practices green and health, safety, environmental policies, because we are impacted by what is happening, in this environment around us and becoming aware of those things. How is your family doing, Delilah? How are all these women, your nieces, these younger women, managing their conditions? How have they been affected? What is their health looking like right now?
Well, as I stated, my niece that was diagnosed just last week, she had a doctor's appointment a couple of days ago. And I haven't spoken to her as of yet to get all of the detailed information. But my sister, her mom she has her back. She's there 100% with her. And I must mention again with this virus going on, it's always nice to have a second person there with you to ask the questions, things that you may miss, have your pen and paper out, but no one can go with her.
Mhm.
So I just thought, maybe she can get a recorder, and she can go back and listen to what the doctor or technician, whatever, has said, so she won't forget anything. So I need to call her and let her know that. And my niece that was just recently found out she has the gene. She opted to have a double mastectomy, which,
Oh,
you know, she was like, Auntie, I'm fine with that. I can have immediate reconstruction. She said, I just want to live, you know.
wow. I think that's a whole separate call. I have so many questions about that as I hear women making that choice. Erin, perhaps we can ask that question in next week's session. We want you all to know we're doing a second session on breast cancer awareness next week, Wednesday, same time.
It's
We will
just,
have medical experts here, physicians, trained, and Erin, you should be on that call as well, because the information you provided today is absolutely illuminating, and we just really appreciate your depth of knowledge and experience in this area. But that is a very crucial question, because we are hearing that women are choosing to have double mastectomies. Once they discover that gene, although we know it's not a guarantee that you will be diagnosed
right,
with breast cancer.
right,
Many choose it as a preemptive
with the-
measure.
right.
So Delilah, what do you want every woman on this call to remember or to know today about breast health as a powerful survivor who is telling her story and saving lives by telling the story?
Yeah. To be proactive, as Erin and yourself stated earlier, take time to listen to your body. Your body speaks volume. It could be anything that's off, that's foretelling. Listen and run to the doctor, get in as quickly as you can. Yeah. And take care of yourself, take care of your mental state. Yes, that's very important. Take time out for you.
Yes, and demand second opinions, third opinions.
Yes,
I know
yes,
a physician, who's on our board, Dr. Debbie Jones, who's talked openly about being a breast cancer survivor, double mastectomy survivor. She sought out multiple opinions before she decided her course of action. Um,
yes,
and she demanded um, answers. And if she didn't get, I loved hearing someone say that yes, they fired their first doctor and they got a second doctor who was who they really needed to go through their journey. And you know what? It really makes a difference to have a physician who listens. It is a matter of life and death. It really
yeah,
is. I've been saying that more on the speaking circuit. When people ask about the role of physicians can make a life or death difference in whether we survive or not. So we will
yes,
not be shy. We will
yes,
not be afraid, even if we have to speak up while our hands are quivering and our knees are shaking. Speak up and
yes,
Delilah has said, as Erin has said, as others have said, take someone with you, have someone on the phone with you while you're asking questions. Have somebody, I've had people on the phone with me in the examination room tuned in if they couldn't physically be there with me. Decide who your advocate and support system are and enlist those people because
Yes.
we have to fight to save our lives and we have to do whatever we can to do that. Erin, I want you to tell us as we get ready to depart from this wonderful call, which I hope you all have found to be super informative. What do women need to hear about protecting their breast health and preventing breast cancer in their lives? What's most crucial?
You are your best advocate. You know your body, no one else does. So make sure that you continue to say, listen to me, this is wrong when something is wrong with your body. And never take no for an answer. It's like my big thing. But I would regularly tell women to stop being ashamed and stop being afraid of the body that you have. You get one. Don't let society's standards dictate how you take care of your body and what you do with it. And it's a reminder to continue to use words that represent the body we have. Breast tissue, breasts, when we talk to our kids. I talk to my 2-year-old, we use the word vulva. We talk about your stomach. We talk about the things, those technical words that you should be using. And some of y'all just got uncomfortable with me saying those words. Stop being uncomfortable with it. They're body parts. And some of your body parts have things that go wrong with them. We need to be able to talk about what our body parts are supposed to be doing and stop being structured on what society thinks we should be doing with our body. Be your own best advocate. Use the words that you're supposed to use. Make sure that you're unashamed of the body you have.
Yes.
Yes.
Thank you, Erin, so much. Thank you so much.
Yes, we want you all to do a clap up for Ms. Delilah. We really want to thank Delilah for joining us today. You know, I could talk with you for a whole hour, another hour, Delilah. I know that there's just much more that we haven't been able to get to in this hour, but what you've shared today has been powerful. And you're so glowing. I just have to tell you, you look so beautiful today with your crown all done up on your head. And
Thank you.
reminded us how precious our lives are and how powerful we are when we choose to fight and we choose to survive. And we thank you
Yes.
for fighting for yourself and for your
Thank
family.
you.
We honor you
Thank
in
you.
that. Erin, we thank you for your expertise. We want to remind you all to go back and revisit many of the resources that we've dropped in the chat today. You see the mammogram pledge. You've been told that if you are under 40, you need to be doing your breast self-exams at home. If you are 40 and up, schedule your first mammogram. We've talked about the Wisconsin Well Woman Program for women 40 and older to access affordable, low-cost screenings and healthcare support. We've said that Planned Parenthood offers free or low cost. I think it's free. I don't even think it costs, but if it's a sliding scale, very affordable, accessible breast and cervical cancer screenings and other healthcare services that they provide. Get to know Planned Parenthood services beyond those that we typically already know about. And call the Foundation for Black Women's Wellness if you're ever needing information. Also get to know Carbone Cancer Center, who's been on the call with us today. If you have someone who's been diagnosed, be their advocate, share these resources, know that there are supports within and outside of our healthcare provider agencies, and that we are always here for you. The last thing I'll drop in the chat is a reminder of what I shared earlier as you were signing on. We are working diligently right now to build a policy blueprint for Black women's health in Wisconsin, because there is no direction that anyone has set about how Wisconsin will protect the lives of Black women, given that we're the state with the highest level of racial health disparities. So we are asking you to participate in a project. We're partnering with Local Voices Network, where we will interview and record your experiences in your healthcare journey to inform this policy blueprint we are writing. I've dropped the link where you can learn information about where to sign up and to be one of our interviewees for this project, which will set a direction for changing and improving our health in the state of Wisconsin. Please participate. Grab that link that I just dropped in. Yes, Corinda, yes, policy blueprint. Yes to all the remarks in the chat, thanking us for this call, and to all the wonderful women survivors out there, and for
Yes.
everyone who is going to leave this call today to make a call in service of your health. With that, we leave you with our parting words. Know thyself, love thyself, heal thyself, heal thyself. Our wellness starts with us, and we are the answer we are seeking. We have the power. Take control of your lives, ladies, and do what Delilah's mother told her to do, and what my mother said to me before she left this earth: live, live, and be happy. We love
I'm
you.
going for a walk.
I am too. Get some fresh air and commune with our mothers as we go. Bless
Yes.
you all, and we will
Thank
see you
you.
here next week. Thank you,
Thank you
Delilah.
all.
Oh,
Be
bye-bye.
blessed. Bye-bye.